Alrighty, so let's have you walk. And you made a comment?
I'm sorry?
Oh, you made a comment when you got up and just started walking, then I interrupted you.
Other than I'm faster.
Are you?
Yep.
So you feel like you're walking faster?
Yep.
And you made a comment about you felt like you were a little bit looser? How so?
And I mean, it's the joint or something back there.
Feels like there's some movement there, is that what you're saying?
Yeah.
Can you point to that joint?
Right there.
Okay.
I mean, I can feel it that it's both sides right there. They move.
So you're saying left and right?
Yeah.
Side?
Yeah.
Okay.
Something. Or else one side's steady and the other side's moving. I don't know.
Okay.
It moves.
So it felt like earlier like it didn't move in retrospect, is that what you're saying?
Before it used to, a lot of times when it would move like that, you can feel those, I call them clunks. It sometimes would feel like backing into or touching an electric fence, and only the shock, it would just drop you. So.
Mm-hmm. And so you're not feeling that now?
No, yeah.
Very good. Let's have you sit and stand up, and I wish that I'd captured that on film. You certainly had some difficulty going from sitting to standing.
Okay. Now.
So go ahead and do it. Do it a couple of times. And then do it one more time, and then just take a few steps.
Okay.
Your thoughts?
Where should I go?
No, you're good right here. That's all I wanted you to do.
Okay.
I just wanted a couple of steps. Your comments on that?
I have a little tenderness back in this area.
Uh-huh.
Kind of there.
Pat, can you comment on that?
Yes, he seems to move easier.
He stood up with great ease.
Yes.
The first time he stood up, he had considerable difficulty,
Yes.
and he stayed bent forward for a while before he was able to
Yeah.
to
Yes, I never thought
straighten
of
up.
that. I can straighten up now.
Yeah, the quality of that movement was so much better, and I'm
Yeah.
regretting not filming that.
Sorry.
So we're off to a start.
Right.
This is the first visit. We've been together maybe an hour and a half, I don't know.
I don't know.
But we've done some slow, I'll call them releases, I'll call them ways of gaining movement by using a fulcrum, a small amount of force, but for a long time,
Right.
lastly, in a very specific direction. And my efforts were directed at treating those things that were, I'm going to say, abnormal in response to the rest of your body. Can we change that right hip? I really don't know. It only gave us 10 degrees. Is that going to last? That might be artifact.
Should
The
I
left knee.
Like go take a walk around the neighborhood or something
I
now?
mean, you could. I'm going to wrap up this filming. We're still filming here.
Oh,
But
alright.
yeah, but my goals are to look and find what I can change in a person's structure to try to improve their overall efficiency. At no point did I expect that you would go from sit to stand as freely as you did. But that in fact is what happened. And there's a lot of debate about the theory of treatment, so I'm not elaborating on that. I am just restoring movement that is normative in a body that's been very traumatized for 30 years. So I'll stop filming.
It would be a good thing to go for a walk.
Yeah.
These things start to feel like
Sounds-
they're tightening up or something.
Okay, that sounds good.